Hello and welcome to the latest podcast from the 6 clinical commissioning groups in Staffordshire and Stoke-on-Trent. I'm Penny Gibbs and today's guest is Dr. Rachel Gallyot. Hello, Rachel.
Hi, Penny.
Thank you so much for your time. So, Rachel, you're a GP in Alrewas at the moment and you're chair of East Staffordshire Clinical Commissioning Group. Can you just tell us a bit about your role and also how you fit into the wider system for the southeast of Staffordshire?
Yeah, so I'm, as you said, I'm GP in Alrewas Surgery and I've been a partner there for over 12 years. I'm also chair of East Staffordshire Clinical Commissioning Group. And as part of that role, I also chair the board that involves all partners in the local healthcare system. So when I talk about the partners, we're talking about the hospitals, council, we're talking about the community services, third sector. So that's quite a big group, and we're talking about restoration recovery around COVID. And I also sit on the board for the healthcare system for Staffordshire and Stoke-on-Trent, the Integrated Care Board. So that's a wider group involving Staffordshire and Stoke-on-Trent. Yeah, covering the healthcare system across that area.
So that's a pretty unique role then, really, isn't it? So as a GP, you're offering all that kind of primary care expertise in those different settings to support the wider system then, really, aren't you?
I'm very privileged to have this interesting role where I can both be at the front line of healthcare in my general practice role and interacting with patients, which is always the really interesting bit that really keeps the other roles very real for me. So yeah, then in the other roles we look at a more strategic view, so an overview of the position of where the healthcare system is going and how it interfaces with that those frontline services. And it is always really important to me that all the other jobs that I do translate into something very real for myself when I'm delivering care to patients. So that's really important that always happens.
And how has the coronavirus affected you? What are you missing?
COVID has significantly affected all parts of the population, and I don't think there'll be anybody listening that hasn't had a direct effect of the situation that we've had with COVID. I'm very mindful of the fact that people have been affected and lost loved ones, and we must never forget that that's occurred. And I've seen that in my practice in Alrewas. And the impact has been far-reaching for people, both physically, mentally, and economically as well. So in my job as GP, I can see that, and it's very, very real for people, with people's mental health, with social isolation, the impact of lockdown. And for me personally, I've known patients for a long time, and I see how that's affected them. I do still see patients face to face, and it's clear that it significantly impacted them. I'm very honoured to be part of that community as well. It clearly is affecting people significantly. So that's in my role as a GP. I can see how patients have had to adapt to the situation, have not seen their own loved ones for a number of months, and that's very, very hard, and they've needed additional support regarding that. I mean, personally, in my it's impacted my own life. I have a mother who's over 75 and in the vulnerable group, and it has been really difficult, just turning up to the house and talking through the window, or shopping, leaving things at the door for her, or running errands for her, and seeing her well up at the door because she just wants to hug her grandchildren. She wants for us to go in, and it is very, very difficult for her, and much of her life is run on Zoom calls or interacting with her friends on Zoom calls, which she's very, very good at technology, but still it is quite isolating, and it's been very important for me to support her from a distance with everything I can. I also have 2 teenage children, and when I talk about it affecting broad areas of society, you can see how, I think in the early phase, the elderly were very, very much affected, but as time passes, you can see the impact on the young as well. So the fact that they can't go out with their friends, they can't do the things that you would expect as they mature and develop into adults, and the lost education that they've had has been significant and required an awful lot of support. And you do compare it to your own life when you were growing up and see the impact that it's had on them when they can't even just go to the cinema with their friends. So I think, you know, you can see from both personally and professionally, you can see how this pandemic has had a significant impact on all areas of society in a different way.
So you mentioned there that in your GP practice, you know, you are still seeing patients face to face. I'm assuming that's kind of when you really need to, because I know there's been an increase in telephone and video consultations. How has that impacted on you as a professional then, being able to consult with patients?
So I have seen particular groups. So absolutely, we have some deaf patients who have been in employment and been very successful in employment, but some of those have been with contact with the public, and that has presented significant challenge to them when the way that they are able to do their job is by lip reading, and the consequences of that have been significant when they're interacting with the public and not being able to understand, and therefore really impacting on them both, not just from a job point of view, but from their mental health as well. I also think that I've seen a lot of parents with young children really needing a lot of support around the day-to-day with young children not being able to do their usual activities, and the big pressure that's put on them. There is also within the NHS a real push for supporting people with learning disabilities as well, and that's so important for people in this group who've previously been able to access social support, and not being able to do that because of COVID. So really a focus on vulnerable groups, and particularly those with learning disabilities, because at this time it's really important that we support them and both them and their carers, and making sure that the COVID restrictions don't end up having an impact further on their physical health.
So with your role and you'll be able to see the other providers and how the system works, what's the impact been like for acute in community trusts? I'm guessing there's been a bit of a delay and hold up on services. What's your experience there?
So with the restrictions, there is a significant ask on hospitals and other providers to adhere to social distancing, to cleaning regimes. They've also been heavily impacted by staff absences, because healthcare workers, as we all know, have been affected by COVID, and sadly many healthcare workers have died as a result of COVID. So their staff numbers have been down. Their ability to put patients through for instance, through their outpatient clinics or through theatre has been significantly slowed down because of the need to socially distance and to ensure that adequate cleaning procedures are done between. So that has impacted on the numbers that they're able to see, and that is still in the context of them having significant amounts of COVID patients. It has varied with obviously the peak, the first wave, and then we've had a peak that exceeded that of the first wave in the second wave, and we are still experiencing high numbers of COVID patients that will occupy beds, and obviously mean that routine operations and routine outpatient clinics become very challenging. So the point of our restoration recovery group in the local area is to ensure that as much of that routine work can continue as possible, while facing the challenges of dealing with patients with COVID-19. So there's been a real clear focus, and I do feel that the hospital community services have really done as much as they can to keep that routine work going whilst still facing the challenges of having COVID patients in a lot of their beds and in intensive care.
So in terms of how you are delivering your services from primary care, is there a different way that you're actually delivering this? Is there a certain model that you're needing to adapt to?
We can't have the same amount of people in the waiting room. We have to clean between patients to ensure that staff and patients are safe who come through the door. So we've adopted a triage first, telephone triage first model. So all patients are spoken to first before they come in. So some of them patients can be treated over the phone. We have really enhanced our digital offer to patients. So if patients are able to, we can do some video consultations. We can have pictures sent in. So if things like rashes and things, we can look at those over the phone, and pictures can be sent in via phone links. This has actually meant that general practice is seeing and doing more consultations than it did this time last year, which is so the patients still have access, but some of the access is through different routes, and lots of patients who are digitally enabled are really positive and have lots of positive feedback because they can do it remotely, they can do it while they're at work, or they can make sure that they they can have those closed episodes and treatment sorted out via the use of technology. So lots of positive, but we will, it's really important to emphasise that we're still seeing a lot of face-to-face patients. So if we feel it's clinically needed, we will see them, and we're still doing home visits to patients that need it. So it's and what we are seeing is that our nursing appointments within practice are in high demand. So it's those patients that need wound care or immunisations or things like cervical smears are still happening in practice, and that's really important for us to continue that routine work of looking after patients with chronic disease. So the model looks different, but we're still seeing and treating more patients than we were this time last year.
So you mentioned there in terms of the work that the practice are delivering, I'm assuming they're going to be involved in vaccinating the population with the COVID-19 vaccine, which is now being rolled out.
Yeah.
With that in mind, and with that coming, what else do we all need to do? What should we continue to do?
So it's really positive, and we're all really delighted that the vaccine has been approved for use, and I think this provides us with some light at the end of the tunnel. But it isn't the answer, and it's certainly not an immediate answer. This is the biggest vaccination programme that the NHS has ever seen in all of its years. And obviously it's going to need 2 doses, and the population that's going to eventually have it is going to be huge numbers. Obviously starting with certain groups to start with, and then those groups will expand as the programme develops. But there's lots of things that we need to say as caveats to this, that it's not going to provide the population with immunity immediately. It's going to take months for that to happen, months and months. And we look at the history of the NHS, so you can look at things like polio. It didn't wipe it out straight away. It took several decades later to wipe that out to the point where we didn't have new cases. So it is going to take a significant amount of time, and people still remain at risk from catching COVID-19 and the terrible consequences that can happen from that. So we cannot emphasise enough how important it is to still wear your masks, wash your hands, and socially distance from people, and really abide by all your local restrictions depending on which tier you're in. Really important that you still do that, because what we don't want to see is unwanted harm or deaths caused, because the feeling is that the vaccine is here to immediately change this situation, because it's not. And I think we hear from government and the medical advisors centrally that people must adhere to it, and it's absolutely true. And as a medic myself, I will be continuing to adhere to those restrictions and those precautions that we all need to take to stay safe in this pandemic.
Thank you so much for your time, Rachel.
Thank you, Penny.